Discourse community. You would ask yourself, what is a discourse community? A discourse community is a community of people that interact with each other in an everyday life. What are some examples? A club, school, church, a state, or city. In this situation, my discourse community will be my job, which is the registered dental assistant. Every discourse community has members. The members in my discourse community would be doctors, which obviously they take care of the patients, doing all the essential work when it comes from resins to composites, crowns, preps, different situations like that. Another member is a registered dental assistant, which is my job. Our duty is to assist the doctors and anything that they need, make sure the room is ready, make sure everything's handed to the doctor in the proper way, and and everything should be done like the doctor asked for. A lab tech, they take care of the dentures, partials, crowns, anything that has to be made, so that way obviously the customer or the patient could come and pick up their crowns and their partials or their dentures. The last one but not least is the front desk girls. They're the ones that take care of us, bringing in the patients, scheduling, calling them, making sure their insurance is active, and make sure we have patients to take care of the day. Next one, we all have rules. The rules that we have, first of all, is use scrubs. Obviously, we cannot just go dressed as whatever we want. We have to use scrubs because it's a proper way to go, and that way we could dispose of that and wash it every day. Make sure we go with a clean scrub every day. Also, another one is good grooming. Good grooming means always have your hair cut correctly or picked up if you have long hair. Make sure you don't have long nails because that it could interfere. Make sure obviously that you're wearing deodorant, perfume, because unfortunately you are really close to the patients and on top of them, and we don't have to give them a bad order. We have to show up on time. That's another big one, because you have to be there in time. Make sure you have to do what you have to do before patients go in, and always finish your job on time. Another big one is respect each other. We have to respect each other as a family. We'll always use respectful words, and never use bad words against anybody, or say anything that you don't want anybody to tell you. The next one will be vocabulary. The vocabulary is really big in this situation because it's something really different from any other discourse community. We have names for each tooth, and I'll go ahead and explain. We start from the front, being the front teeth. They're called the incisors because they're the one that we use to bite. Next one would be the canines, which is the two big frontal tooth that we have in the front. They're the ones that help our bite, guide our bite, make sure we bite correctly. The next ones are called the premolars, which are the small ones after the canines. Those and the molars, which are the back ones, are made for us to chew our food correctly. So that's the importance of having each name. The next one will be the names for each tool. The tools that we use, more important of them is called the handpiece, which is the one that we use to drill, to use when we do crowns, when we do composites, anything that we have to drill or clean inside the mouth. We usually use a handpiece. Another big one is a cavitron, which the cavitron is the one the one that we use for the cleanings, and the composite instruments, which are obviously we only use one composites, but they're used to make sure that the composite material does not spread everywhere and make sure it's really nice and clean for the patient. Abbreviations are also big at work because we're running everywhere and we have to write notes about everything, and we have to make sure we write everything and not take that long. For example, whenever we're writing notes about a patient, instead of writing the whole word patient, we just put PT. Another one, whenever we're going to send someone to go get a root canal done, we just put RCT and then the name of the tooth or the number. And another one would be obviously doctor. We have to put DR. And in this situation is Dr. Domingo and Dr. Elena. So instead of putting the whole name, we just put Dr.E or Dr.D. And it's really important because that also helps us save time and obviously be there for patients. The last one will be our goals. The goals is one of the most important ones, and especially because we have to provide good oral hygiene education. Always when patients go in for their cleanings, we explain to them that they need to brush their teeth at least twice a day. We also let them know that if they brush their teeth more than twice or 2 or 3 times a day, it's too much, and sometimes we could hurt ourselves. So we have to educate them on that. We always give them a new toothbrush, toothpaste, and dental floss so they could go ahead and use at home. Another one, we always want to give a patient a big smile. This could go both 2 ways, okay? One is give a big smile, so we clean their teeth, make sure they have no decay, and whenever they smile, they could see themselves in the mirror and get their self-esteem up and give them a big smile. But another one, it comes from our part, which is always give them a big smile from our part, make them smile, and make sure they enjoy their stay at the office, and make sure they leave wanting to come back. Another big one is make sure patients don't wait too long. We know that everybody's busy and everybody needs to be somewhere else, and we don't want to make them wait, especially in our situation that we see elderly people and they have other appointments with other doctors, and some of them have medical conditions that need to be treated. So that's one of the big ones. And another one is maintain work area clean. This is so important because as we work in a dental office, we always have everything has to be sterilized. Everything has to be clean. And wherever we clean, if we use it, we have to clean it and clean it again. We have special wipes. We have special sprays that we use at work. And then we also put protection on each object that we use, and we have to switch it. And obviously we have to use gloves and all those things. And everything just to make sure that we maintain the area work clean. That way a patient has, the best service that is available. So all of this would make up my Discourse community, which would be registered dental assistant. I hope you enjoyed the video. Thank you very much.